Hi guys, so still on the Rcgp Sca sample cases. The third sample case says this is on a patient called or named Gary Freeman, and this is about a rash. Okay, so let's proceed. Instructions to candidates. Patient's name, Gary Freeman. Age, 82 years. Social and family history. Gary is retired. He's a retired telephone engineer. Gary is married with 2 adult children. Gary's past medical history. Gary has been a patient at his practice for 40 years. It's a long one. He deserves a medal. Gary was diagnosed with hypertension 34 years ago. Gary had ankle swelling 20 years ago. Gary had cramp 7 years ago, so maybe leg cramps, I'm not sure. They also said cramp 7 years ago. Atrial fibrillation 6 years ago. I believe this is maybe diagnosed 6 years ago. Moderate osteoarthritis of both knees, diagnosed 4 years ago. So he's got hypertension, he's got atrial fibrillation, he's got osteoarthritis. They said he's had ankle swelling diagnosed 20 years ago. So I'm not sure if it's just 20 years ago he had ankle swelling or if he's had ongoing ankle swelling. His current medications are quinine. So yeah, it's leg cramps. So he's on quinine 200 milligram once a day, ramipril 10 milligram once a day, furosemide 20 milligram once a day, apixaban 5 milligram twice a day, omeprazole 20 milligram once a day. Investigation results from 2 months ago. Full blood count and U&Es were normal. His creatinine clearance was 98 ml per minute, which was normal. A photo was submitted earlier that day, which is 2 months ago, by the patient. So a photo was submitted 2 months ago by the patient. And that photo, if you look at the Rcgp sample case 3, you'll see that photo. A photo of a skin with a red blotchy rash. Okay, if we're not told that this patient is on apixaban, to be honest, that rash can pass for an eczema. But of course, it's a particular rash. It's red, dotted. It can pass for a viral kind of. It can also pass for a meningococcal rash or a viral rash, depending on the clinical scenario. Okay, depending on the clinical scenario that you are given. In this case, it's a particular rash. And very likely because of his apixaban. So let's move on. Questions for discussion and notes. Is there any helpful information in the case notes to read before starting the consultation? Let's have a look. Very important helpful information. His past medical history. He's got quite an extensive past medical history. He's got AF, he's got hypertension. He's also got ankle swelling. So it's likely he might have heart failure as well. He might have heart failure. He's got bilateral knee osteoarthritis. He's got leg cramps. So it's just good to note. The leg cramps might not be so important, especially if they're controlled. Medication-wise, he's on ramipril, he's on furosemide. These medications, if he's unwell, these medications can cause an AKI. So we need to keep that in mind. He's on apixaban. He's got a petechial kind of rash, so he's probably overdosed on apixaban. His kidney function 2 months ago was normal. It's worth noting. But then he had this rash that was submitted 2 years ago, and probably nothing was done at that point about the rash. He's 82, so 2 months ago he was still very likely 82 or 81, depending on his birthday, or he was above 80. So maybe something should have been done at that stage 2 months ago about this rash and dosing his medication. Let's proceed. Is the picture helpful? It is. It looks like a petechial rash. What is your differential diagnosis for the rash before you start the consultation? It could be petechial rash. It could be an eczema. So depending on, it could be shingles. If you look at the photo, it could be shingles as well. So if you don't know anything about this patient, it's difficult. You might even think, the first time I saw this photo, I thought it was a case on shingles. It was a case, a sample case on shingles, until I went further to understand it's a petechial rash from Rcgp. So it could be shingles. So shingles is your differential. So the patient, I've developed this rash all around the left side of my chest. It's a bit, it has some blisters on it. So you're like, oh, okay, very likely shingle rash. Okay, you begin to ask, does it burn? Is it painful? Things like, is it itchy? And all of that. Has he had it before? It could be shingles. Always keep an open mind in these kind of things. You might be thinking, oh, Rcgp, and it turns out to be shingles. What information do you need to establish? You need to establish the cause of the rash. Has this happened before? Is it itchy? Is it painful? What's the distribution? On which part of the body is the rash? What does the rash look like? Is it flat? Any bumps? Any vesicle? Any blisters? Any wounds on it? Does he feel unwell? Is he feverish, hot and cold? Has he recently come in contact with someone that had a rash? You know what I mean? Has he got a bruising? Has he had a rash? Has he had any trauma? Did he bump that side of his body into something that may have caused the bruise? So, important questions to find out what happened. But the most important thing is, how did this rash come about? Open question. How did this rash come about? And he will tell you, I just woke up one morning and noticed it. He'll give you the history, the story. How might you establish risk and decide upon urgency of next steps? So because you're thinking he could be having petechial rash, you need to check, is there bleeding from any part of his body? Any black stools, any blood in his stool, red blood, any blood in his urine, any headache, any tummy pain, those kind of things you need to establish. So risk assessment. What should you decide or advise about his medication? So this patient is above 80 years and he's on 5 milligram Rcgp twice a day. There are some criteria for reducing, or from indicators or guides to dropping the dose of Rcgp from 5 milligram BD to 2.5 milligram BD. The patient is above 80 years. If the patient's creatinine level is above, I think, 133 micromole per liter. And there's a third one. So there's age, there's kidney function, there's something else. There's a third one where you could need to drop the dose of Rcgp. It just skipped my mind now, but there's a third criterion. If I remember before the end of this video, I'll mention it. What are his concerns and priorities? Very important. You need to explore, what are your concerns? Is there anything you're worried about, especially with this rash? What were you hoping I will do to help? Is there anything in particular you are hoping I will do to help? Expectations. So that's priorities, expectations. And how might these be taken into consideration? Are there solutions you might explore to help with his social situation and support his wife? The purpose, let me see if I could find that Rcgp stuff for you. The purpose of this case is to recognize a petechial rash, the need for urgency in arranging investigations, the safety or otherwise of continuing long-term medication, and an empathic consideration of his home situation with suggestions of solutions that might help. Safety of continuing long-term medication. So in this kind of situation, we need to be safety netting. We need to be explaining that I think this is what we call a petechial rash, which is a bleed in your skin. And this is very likely caused by your blood thinner, the apixaban tablets you're taking for your irregular heartbeat. Do you understand this? What are your thoughts on this? What I think would be safe to do, or what I recommend, which I think is the best thing for us to do in this situation, is to reduce the dose of apixaban by half. So you're currently taking 5 milligrams twice a day from what I can see. Is that correct? I will advise we reduce that dose to 2.5 milligrams twice a day, which is half of what you're taking at the moment. And the reason for this are the fact that you're above 80 years. So I can see you had a normal kidney function 2 months ago. We might need to also repeat your kidney function to make sure that nothing has changed in the last 2 months. Another thing that is important in this kind of thing is thinking, has this patient been unwell? For instance, has this patient developed an AKI that may have worsened their kidney function and has now made the apixaban relatively too much for him because his kidney function was normal? Obviously, being above 80 as well, we need to be thinking about dropping the dose of apixaban to 2.5 milligrams twice a day. So that's the end of this particular case. So keep an open mind. As I said, also keep in mind this could be shingles. So don't just jump into petechial rash, but obviously you need to be checking, is it characterize the rash? How did it come on? I mean, typically, is it painful? Is it itchy? In a petechial rash, there wouldn't be pain, there wouldn't be itch. Okay, so that's something that we need to pay attention to. And he might also have several petechial rashes elsewhere, so we need to be checking that. And of course, we need to be checking for red flags of bleeding, intracranial bleeding, any headaches, bowel bleeding through the urinary tract, which is not really common, on blood thinners. Cheers, guys.